Screen. Yep. All right. Okay, welcome to our first Older Vermonters Caucus of the session. Thank you all for being here today. We typically will start off with any legislators who want to bring up any upcoming legislation or concerns that they have around older Vermonters for this first session. But to get started, I think we're gonna, I'm not sure on having it every week or maybe every other week. There's so much going on. I would like to have Dale come in and have the commissioner come in with her staff and just talk about their initiatives. It's probably going to be best after the governor's budget is released, which is this week. So, right, this week? Next week. So that will probably work out best after we get the budget. So, just a couple of things. We are looking at the budget adjustment right now in the Human Services Committee. And we're going to have some discussion about that today at 1 o'clock after this, after this meeting. So, people can see that our recommendations that will be on our webpage. But so before we get started, does anyone have some legislation they're working on or concerns? Yes, go ahead.
Sure, I can go. So I have a very short form bill. It actually came to me because one of my constituents contacted me about this exact issue. It has to do with retired, well, not necessarily. In the case of the person who came to me, it was a retired Vermonter, an elder woman who is a retired librarian and had a fair bit of savings from her work in a very long career and was scammed out of her retirement. Her money from her bank account ended up going to someone, she doesn't know who portrayed themselves as someone else and said they were contacting her about a issue, and it turned out all her funds were gone. So basically the bill is tax forgiveness. Oh, and then she got a bill from both the state and the Fed saying you owe us a whole bunch of money for all this money that she didn't have anymore, which had been removed from her. So she was an elder woman who not only lost her savings, but then owed the Feds and the state a bunch of money. And they're about, from what I gather, there are about 150 cases of this a year. And this is devastating for folks. It's not entirely elder Vermonters, but it's mostly elder Vermonters. And if we could do something to make it a little less difficult in those situations for these folks, I would like to see what we could do.
Yeah, thank you for bringing that up. We've actually had some discussions around financial exploitation of older Vermonters in this caucus in the past, and it's definitely ongoing. And now with more of the AI that's out there, I think we need to really start thinking about how we protect people from this elder fraud. So that will probably be an upcoming topic. Absolutely. We've had it in the past and maybe we should continue with it. Go ahead. Say who you are. Oh, this is Representative Bob. I'll come back to you. Go ahead.
I really appreciate hearing from Rep. Boslin. And I think with that legislation, the idea is that they would not have to pay the state taxes. Yeah, that's really troubling. So I'm Representative Deratori. I live in Moortown. I represent Washington too. And I have had a really tough fall in my community with the proposed closure of our primary care facility, as well as one of our rehab facilities that UVM Medical Center operates. So our community is really concerned about access to care, especially for older Vermonters who have limited transportation options. So I've been trying to just get caught up on the universe of options for community-based primary care. So I've become, I'm just trying to learn a lot of things. And I know Michelle, Rep. Boslin, you have a federally qualified health center in your district that has already closed. So just thoughts and partners and thinking about what happens in these communities with that loss. And whether they're, what kind of extra services or support can we tap from the Agency of Human Services? What types of pilots we might be ripe to host in our communities? And on the other idea that a constituent brought to my attention this fall was the idea of using tapping into our EMS providers much more for primary care in the home. And apparently we do have a model, a pilot underway now through Brattleboro Hospital that involves home visits after certain types of care and procedures happen. So that's an area I'm really interested in, and EMS in general. So if anybody's aware of things that are moving along those lines, I'd love to talk to you. That's kind of big stuff.
Yeah, and there's no doubt a lot of our skilled nursing facilities are in trouble financially, and you'll see in the budget adjustment quite a bit of money to provide them with emergency financial relief. It's around 21 million proposed in emergency financial relief, and then 24 million in just underutilization or just bringing the rates up. So that's a big chunk of money just for skilled nursing facilities. And that's not even looking at our residential care. And so I think you'll see some discussion in the Human Services Committee as we take up H13, which is home and community based rates. So looking at how we reimburse our providers. We're going to be having some discussion on that coming up in the Human Services Committee. So I think that's something that is hitting all of our communities, and access to whether it's primary care or long-term care is super important to have that, especially close by to where people's family connections are and where their communities are, because it's kind of hard when you have someone from Wolcott who needs a skilled nursing facility and the bed is in Brattleboro. That's just doesn't really work, but so that will be something that's coming up. Yes.
I'm, excuse me, Representative Mary Howard, and I represent Rutland District 6. Rutland Hospital was threatened with having to move or dissolve their dialysis center. And I can't tell you the number of people that were so upset, the number of phone calls and texts and emails that I received. And fortunately, that did not happen. I sit on the General Housing Committee. So housing is the key to everything. I received several calls from professionals saying they want to hire this veterinarian. Do I know of any apartments available? The nurses, teachers, and so we need more affordable housing so that we can get people to come to our beautiful state. So it's a tough issue. It truly is. It's heart-wrenching. I know that there are many homes where older people live in, big homes, and it's just maybe one or two of them. And trying, they would be willing to sell their home, but where are they going to go? So that's been an issue as well. And I'll stop there. Thank you.
Yeah, and I included a link to a new housing report that just came out in the announcement for this meeting. Some good information around housing for older Vermonters. So take a look at that. It's really right off the press. So it's some up-to-date information that's helpful in this upcoming legislative session, because there's no doubt we need to make some serious investment in housing for older Vermonters as even possibly a way to open up more housing stock. And back to when we were talking about skilled nursing facilities and access to long-term care, we need housing in people's communities, because that's where their connections are. That's where they want to live, and they're not going to leave their house if they have no place to go. So just a couple of bills before I turn it over to our guest today that I've been working on, looking at further exemptions for the tax on Social Security. Representative Harrison from Chittenden and I have a bill, should be coming out this week. I was surprised it wasn't on for today, so it'll probably be on for tomorrow for first reading. It looks at expanding the exemption for 15,000 in the first year, 12,000 in the second year, and then an additional 10,000 per year over the course of its total time of 8 years to exempt it. And the reason for that is the total's around 54 million revenue loss to the state. So that's how much we take in on the tax on Social Security. The first year would be 5.3 million. So, we wanted to span it over 8 years so that it wouldn't be a $54 million hit in the first year. So we'll see if that gets some airtime in Ways and Means Committee. So there'll be more coming out on that. And then I'm also working on some legislation around a commission on aging. So this is looking at how we implement our Age Strong Vermont plan. It's got some a drafting request in. It's going to take a while back and forth, but that should be coming out pretty soon, almost like the Vermont Commission on Women or some of the other commissions we have, really looking at it holistically from how we provide services and supports to older Vermonters. With that, I don't know, anybody online have any announcements or anything real quick before we turn it over to our presenter today? Okay, anything else from the room? Anybody? Okay. So thank you, Dr. Chung, for being here today. I will turn it over to you. Appreciate you coming to our caucus, the first one. So
thank you so much. I'm happy to be here virtually. I have a cold. I was hoping to be there with you in person. I'm going to just pull up my slides to share these with you. Let's see here.
all right, I think everyone online should be able to see it as well. That's what it looks like from where I can see it here in the room.
Okay. Great. I'm just going to try to pull up my presenter slides to make it a little easier for me. All right. Are you still able to see the
Yes.
main slides? Great.
Yep.
Fantastic. Well, Dan, thanks so much for inviting me. This is great. And it's nice to hear some of the issues that are being brought up by the Vermonters living in the community, speaking with the representatives. And I, as a nephrologist, caring for people with kidney failure and with kidney disease, I certainly empathize with the constituents who are upset and worried about dialysis units closing in our satellite units. I also just want to thank everyone who's helped put this presentation together, my staff and colleagues, and the folks who are doing the really good work with us in the Center on Aging, from the Dementia Family Caregiver Center, from the Social Work Department at UVM, and all of our colleagues, the geriatricians at UVM Lerner College of Medicine. So I think some of you know the Center on Aging. Let me know if you can see the slide that I just advanced.
Yep.
Okay, great. So this is just familiarizing you with our mission. Our goal is really to forge a collaboration among faculty, students, staff, and programs at UVM, at the medical center and the health network, and within the community with the overall mission of promoting a sense of well-being and a high quality of life for older Vermonters. We have three cores, or cornerstones in the center: research, education, and public policy. And I'll share with you some additional details about the work that's going on in the course. We are a small, mighty staff. I'm the interim director. There's currently a search for a new director who will also be the chief of geriatrics at UVM. Kate Martin is there with you in person, and Marissa Byrne, leading our cores in public policy and outreach, and also education. And Rick is with us online, leading up community relations, and also helping to launch a new initiative that I'll tell you about in a little bit. So we're supported by our faculty advisory board. We have a number of different colleagues from across the campus, not just in the College of Medicine, folks that work in the memory clinic like Steele, Taylor, folks who are doing research on caregiving like Mayor Reblin, folks in audiology like Dr. Adams, and so on. So many people that are involved and are really dedicated to our mission. And what's really nice is that they come from all of these different colleges, from arts and science, education, nursing, physical therapy, and so on. So none of this is probably news to you, but I thought I would share some statistics just about the need for having a center on aging. Vermont has the fourth oldest population in the country, maybe the third oldest population. And you can see in this graph, the green line is showing the people, percent of the population 60 and older has gone from 17% in 2000 up to 28%. So from a clinician's point of view, we see a lot of older adults in the hospital and the clinic. Many of them have multimorbidity. They have a unique set of needs. But in the community, older adults are also working. Maybe they retired and went back to work. Many of them are volunteering. They're caregivers for younger children and older adults. So the growth in older adults in the population, I think, poses unique opportunities for us as a society. And from the Center on Aging perspective, we see a lot of opportunities to integrate geriatric principles into the education for the Larner College of Medicine and across the other colleges, to train future leaders in medicine and public health to really be attuned to the needs of older adults. We see it as an opportunity to transform public policy and implement evidence-based programs, and to expand our capacity to innovate, inspire, and engage age-friendly health systems across Vermont. So a few years ago, we became part of the Age-Friendly University Network. It's a global network of higher education institutions committed to promoting positive and healthy aging and enhancing the lives of older adults in the global community, doing this through a variety of different efforts, including educational programs, research agendas, curriculum development, online education, health and wellness activities, cultural programs. And there's 10 guiding principles, and I've listed them here for you to see. What we did is we asked the faculty advisory board to help us rank what are the most important priorities, because there's so many different things that we could do, but to try to focus our energies at the Center on Aging. These were the top 3 that came up: encouraging the participation of older adults in all the core activities of the university, including education and research programs; to promote intergenerational learning in order to facilitate reciprocal sharing of expertise among learners of all ages, and to ensure that university's research agenda is informed by the needs of an aging society, and to promote discourse on how higher education can better respond to the varied interests and needs of older adults. So we're using these priorities to basically guide our energy and our work. And so I'm going to share with you some of our initiatives. So for our first core that I'll tell you about is our research core. This is the core that I lead. And our mission is really to develop a pool of talented researchers investigating aging here at the University of Vermont. And so we reinstated a pilot program just last year. The pilot grant was named for Dr. Grams, who taught several courses on gerontology at UVM and was instrumental in both establishing the UVM Center on Aging and the gerontology certificate program. So we had a pilot grant this past year for $75,000 for a faculty or a team of faculty to support their project and their work over 1 to 2 years. And this is the team that won the award. It's Dr. Denise Peters in the red here on the left, and Dr. David Jangrar just behind her. This project is going to assess usability and predictive validity of in-home instruments, basically designed to measure mobility, activities of daily living, and speech production in aging rural Vermonters with and without cognitive impairment. So they're going to look at some instruments that are really usable and effective in the rural setting, and then they're going to basically generate pilot data that will allow them to apply for future national funding. So this is bringing together 5 different researchers from across campus, from across different colleges, the College of Engineering. We have folks in Dr. Sam Fox, who does work in movement analysis, and so these wearable sensors. And we have scientists in the College of Nursing and Health Sciences and Physical and Occupational Therapy, who also do research in sensor technology. And the idea is that they will be able to try to detect changes in function before somebody ends up needing to be admitted to the hospital or have some significant decline. And so this is really innovative work, and we're really excited to have them thinking about their research, which could go in a number of different ways, but to come together and focus on something that has to do with older Vermonters. This is just a quote from Dr. Peters saying that working with rural Vermonters in their home has the potential to be incredibly impactful. This is where functional independence matters most. We're really excited about the potential ways we can design and utilize in-home healthcare technology to allow individuals to live longer and remain safe in the place they feel most comfortable, their own homes. One of our other initiatives is the Vermont Older Adult Research Registry. This was started by Dr. Nancy Gell. She created the registry. It has some loose eligibility criteria. You just need to be 50 years or older, interested in taking part in research, and willing to complete a questionnaire to join. And then you just update your information once a year. You can join by going to this link here, which is just our website, the Center on Aging, and you just click on the research button and it'll bring you over to the registry. So, why join? This is really to help people get involved. People that want to help others, they might enjoy volunteering, they might want to contribute to research and help create knowledge about aging. It's free and it's confidential, and you can remove yourself from the registry at any time. So we're also collaborating with our faculty at the medical center to advance the age-friendly health system. So as you know, the aging population is increasing, but the healthcare system has really struggled, nationwide to reliably provide evidence-based care to every older adult at every care interaction. So the Age-Friendly Health System is an initiative from the John A. Hartford Foundation and the Institute for Healthcare Improvement, IHI, and the American Hospital Association, designed to meet this challenge. So the idea is that an age-friendly health system follows a set of evidence-based practices, causes no harm, and aligns with what matters to the older adults and their family caregivers. So to become an age-friendly health system, you have to reliably provide a set of 4 evidence-based elements on high-quality care, known as the 4 M's, and that's what's shown in this picture here. What matters, medications, mentation, and mobility. So one of our faculty advisory board members, Dr. Nat Elder, who's an emergency medicine physician, has already started to implement this work in the emergency department. And Dr. Tanya Vanderlyn has started to do this work on our alternative care unit at UVM Medical Center, working to create processes that can then be adopted across the network. And this is really the type of work that can transform how we care for older adults in the hospital system. Many of you may know of the Dementia Family Caregiver Center. It's recently in 2023 became its own center at UVM Medical Center. This was developed out of a longstanding relationship between the Center on Aging and the Memory Program at UVMMC. And they really recognize the critical work that family and caregivers provide for, especially for folks with dementia, and their unmet needs. So 24% of caregivers for people with dementia spend 40 or more hours per week on caregiving responsibilities. And a quarter of caregivers for a person with dementia would say that they have 10 or more poor mental health days in a month. They need respite, they need mentorship, and they need training. This is an incredible work that they're doing. So the Dementia Family Caregiver Center, led by Lori McKenna, they offer consultations. They have a number of other programs, the Vermont Cares program, which was born out of work from the Mount Sinai Hospital in Toronto, is an evidence-based program that provides coaching, advocacy, respite, education, relationship, and simulation. And then there's also their Teach program, and they have a peer-to-peer mentoring program. And really all you have to do is email them or give them a call. They have also partnered with us to help create workforce development programs, specifically for social workers working with folks in dementia. So we all know about the workforce shortages. I think this is such an interesting time because I think there's also just so many opportunities to get students involved, and it's one of the reasons I'm so excited to be at the Center on Aging at UVM. Work that Marissa Byrne has done recently has created a student advisory board and has taken our intergenerational activities and continue to grow those. So I'll tell you a little bit about the Grand Friends program. So this is a lovely program that was recently featured on Across the Fence. One of the main issues that I think that this addresses beyond ageism is really just that students might not consider careers in aging because they don't have exposure to working with older adults. So the Center on Aging is integrating meaningful interaction with older Vermonters into courses about aging through service learning programs like this Grand Friends program. So Grand Friends matches UVM students with older adult volunteers in the community, potentially people that have listed themselves on the Older Vermonters Research Registry. And then through their participation in the psychology and social work classes about aging, they basically meet regularly throughout the semester, and they build relationships and learn from one another's experiences. And then the students get to apply what they're learning to their courses. And the older adults contribute to the students' learning by sharing, their wisdom. And they have an eager listener. So there's several courses that are using this intergenerational learning opportunity, the human development and family science, psychology of aging, and also aging, change, and adaptation. The Vermont Bridges program is the workforce development program that I was mentioning earlier with the Dementia Family Caregiver Center. So it's a joint partnership with Dementia Family Caregiver Center, Center on Aging, and Social Work Department. And it stands for Vermont Broadening Resources in Developing Gerontological Education and Social Work. So really seeking to address the workforce shortage, providing one-on-one mentorship with aging-focused social worker, and internships with community partners and the Center on Aging. And last year, the interns came together and created a Traveling Careers in Aging Fair, which reached over 200 students, sharing their excitement and interests in careers in aging. One of the key parts of our education core is providing educational opportunities for professionals. The Vermont Geriatrics Conference takes place every spring. This is primarily for medical professionals and gives practical and innovative approaches for caring for older patients. And then our Gerontology Symposium, which will be on May 6th this year, is another opportunity for folks to come together and learn. This is also available to caregivers as well as older adults. We'll be facilitating conversations on how to foster a more age-friendly community. There are a number of other educational opportunities that are also opportunities really to just engage together and think about aging from a variety of perspectives. The Lake Champlain Memory Cafe provides a inclusive space for people with memory loss and their loved ones to enjoy quality time together. This creates a community of participants that can empathize with one another's experiences. And the attendance has really gone up over the past few months with 10 participants and a student volunteer at their most recent session. And this is in collaboration with the Burlington Aging Council. We also developed a faculty and student book club, which will be kicking off very soon. And I'm also excited to share with you the launch of LEAP, which is the Learning Enhancement in Aging program. So this was created with the goal of increasing the age-friendly workforce of health and social service professionals that are already serving older adults in rural communities. We've already told you about the Vermont Bridges, which is addressing social work interns and helping them to become interested and engaged in caring for older adults. This is now working with folks who are already in the field. So LEAP is an online geriatrics curriculum with networking opportunities to enhance the competencies in aging and also to increase access to appropriate health and social care for clients and caregivers and to increase job satisfaction as well. This just kicked off at the beginning of January. Our hope is that this will increase the skill and confidence for folks working with older adults and their caregivers and then contribute to the workforce. So if there are folks that are interested, that they can also reach out to us about potentially joining the next cohort that will be participating in the LEAP program just by emailing us. This is supported by the Vermont Community Foundation. So I'm gonna wrap it up. I hope that I've left you inspired by some of the work that we're doing and interested. I want to thank all of our partners. I want to thank Kate Martin, Marissa Byrne, and Rick New, our staff in the Center on Aging, and all of our partners. I'm happy to take any questions that you might have.
Great, thank you so much. I think I'm unmuted, yes. Yeah, I appreciate seeing the integration of geriatrics into across a lot of the work that you're doing, because we've heard in the past how few gerontologists there are in Vermont. And when we look at the population, it's kind of surprising that there's only a few that are here. So I think I'm glad to see the emphasis on that. Also, the age-friendly university. That's great. Thank you. There's another university in Vermont that has not done that yet, but I've asked them to. So hopefully they will. That would be the Vermont State University. Yeah. Are there any questions or anything anyone has?
I don't have a question, but I just have a comment. I think this is wonderful. My mom lived in Connecticut, and she worked in what was my old high school as a hallway monitor. They hired senior citizens to be hallway monitors at the high school. I was a little nervous about it because she's this, little 5-foot, a little Italian lady. And I said, don't take your pocketbook to school. I was so worried about her. She loved it. And the kids absolutely adored her. At one time they were let go. And, but then I had stopped at her house and she was having coffee with the mayor of the city. And they all got hired back and the kids were just so thrilled. The principal also used her language skills because he needed a translator for a grandparent. after they were let go, my mother was 90 years old. She would get up at 5 a.m. She would go to the school. She'd make coffee for the teachers. I mean, she loved her job. And they were let go again and they were replaced by guards. And my mother's health went down completely. She ended up in assisted living and she passed when she was 93. I mean, it's so important for the seniors to have a purpose, if they're in good enough health, to have some place to go and to be with people. It's just, we are so grateful for that job. In fact, one of the teachers said to me, "Thank you for sending her to us. I had nothing to do with it." But she truly loved it. And I think it's so important. And I'll just quickly say another thing. We always hear about the aging population in the state. But what we don't hear is the healthy aging population that volunteers in hospitals, that volunteer in schools, that are, like school grandparents. We don't hear about that. And I think we need to hear more about that. Thank you.
Yeah, thank you. Yeah, and that intergenerational relationships and of being in schools, or as Dr. Chung was talking about with the work they're doing about connecting people together at the university is so important. So yeah, any other comments or questions or things people want to bring up? Yeah, go ahead.
Comment, I really enjoyed this presentation and learning about all the great work you're doing there. And just in terms of the intergenerational learning and the Grand Friends program, I'm thinking about my daughter when she was in college. She took some sort of writing course that involved memoir or something, and she interviewed her grandmother. 2 years later, she produced this wonderful, not too long, memoir of some key moments in her life. And I wonder if that is something that a Grand Friends program might involve for students that like to write and tell and then the story and the extracting highlights. It was just so powerful to read it.
It's a wonderful idea, and I really appreciate you sharing both of those examples of how powerful intergenerational connection can be both for younger people and older people in passing on stories and love and care, and also having the opportunity to learn from and honor those stories. So right now in the class this fall, students did prepare life reviews of their grand friends that they then presented and shared with their class. And many of them did offer those to their grand friends too, to be able to share with loved ones. Thank you.
Yeah, go ahead.
Doug Bishop, representative from Colchester, new this session, so I'm glad to be in the room here and remotely with folks. So Dr. Chung, thank you very much for the presentation. I'm wondering what work may be done with the university or other programs integrated with either United Way of Northwest Vermont due to the UVM Medical Center's location, or the broader United Ways of Vermont and some of the work they do. I think, as I understand it, at least historically, that they've done to bring seniors in as volunteers and the like. Is there any current relationship with United Ways?
I'll let Kat speak first, and then I can check if there's anything I can add.
Yeah, I'm not aware of any formal relationship. You mean specifically with the Center on Aging or at the university in general?
The Center on Aging.
Right. Yeah, I don't think that we have any formal relationship.
Yeah.
It's a good question. I know they have the RSVP program and are focused on providing meaningful volunteer opportunities for older adults, like what we can offer in the Grand Friends program. So we've thought about ways of uplifting their work, like perhaps including them in a gerontology symposium at some point, or we also book a speaker related to issues around aging on Across the Fence each month. So there could be opportunities for collaboration there, but I think we should reach out
Yeah.
and maybe explore more ideas. Thank you.
One more idea.
Yeah.
I have wonderful constituents. Who many of them are retired with just amazing skill sets. And when I came to the legislature last session for my first term, I thought about what wonderful interns they would make. And I'm wondering with you as UVM, we have wonderful young interns. But what about the possibility of older interns?
Yeah, I think that would be fantastic. Yeah, absolutely. And I think, one of the ways to get people involved might be through the registry to say, I'm interested. For folks, we have sort of redone our website and hopefully made it a little easier to find information, but reaching out. And that really is addressing one of the age-friendly university principles, is really helping folks to find meaningful work at, maybe after retirement or re-engaging. I think it'd be fantastic.
Great. Well, thank you so much. One of the things that I just wanted to point out, there was a report that just came out from Public Assets. I should have included it. And it talks about poverty in Vermont for older Vermonters. And it says Vermont saw the biggest increase in elder poverty among all the New England states. So, we definitely have some work to do here in the legislature around poverty and older Vermonters. And then I just got an email from 7 Days that there's a story they just put out around retiring in Vermont. I haven't read it yet.
They have
but-
one like a week ago on tax fraud.
Okay.
The fraud issue
Oh.
for older Vermonters that was in
Yeah.
7 Days last week.
So we're getting some press around this, and perfect stuff we should be talking about. And yeah, Representative O'Brien.
And so why is that growing, poverty among old?
I don't believe it says it in the report, but obviously inflation, cost of living, and a lot of a lot of people's pensions or Social Security is not keeping up with inflation. So I'm sure that has a lot to do with it. It's mostly in more rural parts of our state. So, yep. All right. Well, thank you so much, everybody, for coming today. And thank you for bringing pizza. Appreciate that. I'm going to have something to eat today. Oh, yeah. Sorry.
Pat Persico from Johnson. You mentioned Mad River losing their healthcare. I think Lamoille County, Copley Hospital and Lamoille Partnership, they're in trouble. So is that on the radar, and how is that being addressed?
It's definitely on the radar. I think, the primary care is so important to have in Lamoille County as it is in any community in Vermont. And there definitely is a lot of discussions going on about that.
No answers yet, discussions?
Well, I think they're moving towards a good answer. We'll see as the work through the budgeting process here in the building.
That would be a massive blow.
Oh, absolutely. No doubt about it. Yep.
And one other sidebar with prescriptions. So I take Eliquis, and I get it through the Stowe Pharmacy.
Mhm.
And so with the Stowe Pharmacy, it's $100 for 3 months. If I didn't have that, it would be close to $900 for 3 months.
Wow.
So those are the programs that I'm not quite sure where it comes from, but it needs to be.
Yeah, that's through our FQHC. Super important to be able to have people be able to afford their medications. Yep. Okay. Thank you so much, everybody. Back to work. Take care. Thank you. Thank you, Dr. Chung.
If anybody wants to co-sponsor on the forgiveness. I'm gonna put it in soon. Wow, so glad you're doing this.